Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The mouth is often one of the most neglected parts of the body. What do I mean by this? Few people will visit a dentist to check on the health of their teeth. Tonight on the Doctalk show, we are pleased to host two dentists in studio. We have Dr. Deborah Anonia Isavie from Debino Dental Clinic and Dr. Kaliesubula Nelson from Jubilee Dental to tell us more about dental health, the health of your teeth, with special focus on dental caries. So you're most welcome to the show, our guest dentists or doctors. And I am your host for the show, Dr. Darius Wachi. So let us dig in to understand more about dental health and dental caries. Why is it so important? And what we should do to take good care of our teeth. Looking at teeth, we know teeth or the mouth, people tend to ignore it a lot. Yet it seems to be a very important field of medicine. It's a very important organ of the body, the mouth, because we use the mouth a lot for eating, for doing all sorts of activities, even talking. So why do you think there's poor health-seeking behavior with regards to the mouth?
Most people in our setup, they're reluctant to seek dental health care or find out what's happening with their teeth, particularly because of very many factors. But the most common factor that is behind this is that most of our population is so illiterate as pertains dental issues. People don't know that
they don't really know about dental health.
Exactly. They don't know that teeth need to be cleaned how many times a day. Teeth need to be checked after a given period of time. What are the problems of teeth? So they don't even look beyond that teeth can actually affect other systems of the body.
Yeah. And teeth are also health, they are living structures of the body.
Definitely.
So even if someone falls sick of malaria, they'll be ill because they'll have some certain symptoms.
Actually, we also forget that the mouth is the entrance to the body. It is the entrance to the systems of the body. Whatever you take in to the rest of the body passes through the mouth. So let's imagine you take in something, but you don't pay attention to where it is passing to go into the body. That is the mouth. So most times we worry about the stomach, what I will eat. We worry about what will come out. I'm not releasing so well. But we forget where that food passes to get to the rest of the body. That is the mouth. Where the food passes, is it healthy? As it passes through that entrance to the rest of the body, what does it meet on its way? Is it accommodative? Are they there to start with? You like to eat, but do you have what is used to eat? Do you have the teeth?
Are the teeth in good hygiene?
Are they there to start with? Some of us lose them way earlier. Others, you just find your teeth shaking and you ask yourself, why are my teeth shaking? And yet they appear so good. They appear so okay. No holes, no nothing, but they're just shaking. Why are they shaking? So it is really good to pay attention to the entrance of the body. That is the mouth.
And there are very many diseases that can affect the mouth, affecting the teeth, affecting the gums, even the tongue, all the deeper structures of the mouth. So why don't people like going to see the dentist?
People have phobia for the dentist.
They have like a fear.
They have a fear to go and access dental treatment, thinking that when they go there, the injections are going to be too many, too painful. When you look at the metallic armamentarium or the equipment we use, the dental chair itself is scary. So all that puts fear in the patients or the population, and then it will inhibit them from seeing or seeking dental treatment.
But is it really that painful, the dental checkups?
Then the checkup is not painful. Definitely treatment, the injection, there's some minimal pain, But nowadays, there are very many advanced, painless, free procedures that can be taken. There is topical anesthesia to numb the site prior to the injection. The injection, the dental injection itself is a tiny, it's a tiny millimeter gauge needle, so you just feel a tiny prick. Unlike those previous days, but there's a lot of technology.
It is almost painless.
Painless.
Yes. But also to put aside the fear and everything, let's start with the knowledge. Do people even know that there are doctors called dentists? Do they know that I can actually go to someone and they work on only the mouth? People think that when I'm sick and maybe my tooth is hurting, I'll go to a nurse, I'll go to a village health advisor, and probably they will advise, yes, or to a pharmacist, and just get a Panadol to treat a tooth. So there is that ignorance. Before you even get to the fear, a big population, let's say in Uganda, people are so ignorant about dental. Let's put the ignorance aside, even to talk about the doctors or the dentists. We are so few in the country. If you look at the patient-doctor ratio, the patients might be so many. The population of Uganda, I think we are over 41 million. But if you look at the doctors or the dentists in the country, I think we are about 300. Now just imagine, the 300, let's say the biggest percentage of the 300 are based in the urban areas. We are based in Kampala, we are based in Jinja, we are based in Mbale, those top districts. But when you go down, deep down in the villages, people don't know that there's a doctor called a dentist. They don't even know that when I'm sick, as in the mouth even falls sick, and there's someone to reach to and ask for help. So that is the ignorance, not only ignorance, but the health-seeking, let's say the behavior and the health sector, let's say the dental sector of health. It is neglected. People are not coming out to study the field. So we end up being few and we can't reach everyone. So people will stay ignorant about the condition.
If people neglect dental hygiene, what can happen?
If you neglect your oral hygiene or your dental hygiene, you're going to face a few consequences. For instance, I'll give the common one. You could miss your work if you're working because of sudden or spontaneous toothache. For kids, they could miss out on school, which is very disturbing. And your functionality, your whole functionality, you could miss out on eating well or chewing well. You could miss out on having your meals because of pain. So if you miss out on taking care of your dental hygiene and following it up through a dentist to assess you and tell you what could be going on, because remember, this is a slow gradual process. Initially, you could be having no pain, but you just check it's a cavity there. It's not paining, okay. You're buying time, but then you might reach a point where you'll have that severe pain and then you end up missing out on quite a number of things.
Toothaches are very painful. One can barely do any work with it.
Exactly.
Yes. And that's also, in addition, they can get all sorts of dental illnesses. Remember, you can always subscribe on our social media platforms, that is Facebook, Twitter. You can also log on to YouTube and watch some of these videos that will be uploaded. If you're enjoying some of these shows, feel free to share and to like and to tell your friends about the show. And just after the break, we shall come back and discuss more about dental caries and its impact on health.
You are watching the Doctalk Show.